About World Pharmacy Day. World Pharmacist Day is a global initiative that highlights the vital role of pharmacists in healthcare. The day, 25th September, marks the anniversary of the inception of FIP in 1912 and was adopted by the FIP Council in 2009. As such, the World Pharmacist Day campaign is led by FIP every year, with a theme chosen by the FIP Bureau. In 2020, FIP also created World Pharmacy Week, extending the celebrations of the entire profession and overtly encompassing all sectors of pharmacy profession. Theme 2025. The World Pharmacist Day 2025 theme is Think Health, Think Pharmacist. This theme highlights the vital role pharmacists play in public health, emphasizing their contributions to sustainable healthcare systems, patient counseling, and overall health and well-being. Why this theme? This theme is chosen by the International Pharmaceutical Federation FIP to emphasize why pharmacists should be recognized as the first point of contact for health. Here is why this theme is chosen. Healthcare systems under pressure. Around the world, health systems are struggling with shortages of doctors, nurses, and other health professionals, along with financial pressures. Pharmacists are the most accessible healthcare providers, often available without an appointment, and can help ease this burden. Expanding roles of pharmacists. Pharmacists today are not only medicine dispensers but also providers of vaccinations, chronic disease management, health screenings, and patient counseling. They improve medication safety and adherence, which saves lives and reduces hospital admissions. Public health leadership. During crises like COVID-19 pandemic, pharmacists proved they are frontline health workers. The theme reminds people that whenever they think health, they should also think pharmacist as a trusted advisor. Global message of trust and accessibility. Pharmacists are found in almost every community worldwide. This theme reinforces the idea that seeking a pharmacist's help is an important step towards healthier communities. In short, the theme recognizes pharmacists as central to strengthening health systems and improving patient access to care, especially at a time when healthcare faces unprecedented challenges. Why we can't think of health without a pharmacist, or why pharmacists are important in healthcare systems. Pharmacy without pharmacists is a risk to health. A pharmacy is not just a shop for medicines, it is a healthcare facility. Medicines are powerful and if used incorrectly can cause serious side effects, drug interactions, overdoses, or treatment failures. Only a trained pharmacist has the expertise to ensure correct drug selection, accurate dosage and administration, avoidance of harmful drug interactions, guidance on proper use and adherence. Without pharmacists, the public is at increased risk of medication errors, self-medication misuse, counterfeit medicines, and lack of counseling. Investing in pharmacists is equal to sustainability, safety, and smart spending. Sustainability. Pharmacists help reduce the burden on health systems by providing preventive care, vaccination, health screenings, counselings, which decrease hospital admissions and long-term costs. Safety. Pharmacists act as the final checkpoint between prescriber and the patient, ensuring the treatment is safe and effective. Smart spending. Pharmacists reduce wasteful spending by preventing duplication of medicines, misuse, or avoidable complications, which ultimately saves governments and patients millions in healthcare costs. The risk of replacing pharmacists with untrained staff. In some regions, budget pressures have led to hiring non-professional or unqualified workers to run pharmacies. While this may appear cheaper initially, it has long-term consequences. Medication errors, wrong drugs or wrong doses being given. Lack of patient counseling. Patient may not know how to take medicine correctly. Antimicrobial resistance. Unchecked dispensing of antibiotics without pharmacist oversight fuel resistance. Increased hospital admissions. Errors and poor guidance led to complications and higher treatment costs. Loss of public trust. Communities lose confidence in health systems when avoidable harm occurs. Why pharmacists are irreplaceable in healthcare? Pharmacists are not only medicine experts but also public health professionals. They contribute in chronic disease management, vaccination and preventive care, health education and awareness, ensuring equitable access to safe and effective medicines. Replacing them with untrained staff reduces healthcare quality and undermines patient safety. Conclusion. Pharmacy without pharmacists put lives at risk. Policymakers who invest in pharmacists are strengthening healthcare systems for the future, ensuring sustainability, safety, and smart spending. Short-term cost cutting by replacing pharmacists with untrained staff only leads to long-term harm, higher costs, and compromised patient care. 10 strategies to achieve the theme. Public awareness campaigns. Launch community outreach programs like health talks, media campaigns, social media drives to raise awareness of pharmacists as frontline healthcare providers. Medicine safety programs. Strengthen medication counseling, drug interaction checks, and adverse drug reaction reporting to highlight pharmacists' role in patient safety. Pharmacist-led clinics and services. Expand pharmacist-run services for chronic diseases like diabetes, hypertension, asthma, and preventive care, immunizations, and screenings. Antimicrobial stewardship led initiatives to curb antibiotic misuse and antimicrobial resistance through strict dispensing, education, and monitoring. Collaboration with other healthcare professionals. Integrate pharmacists into multidisciplinary healthcare teams to emphasize their value in improving treatment outcomes. Policy advocacy. Engage with policymakers to secure recognition of pharmacists' roles, protect pharmacy from being staffed by untrained personnel, and ensure fair investment in the profession. Education and continuous professional development. Promote lifelong learning, training in new clinical skills, and research to keep pharmacists updated with global healthcare needs. Access in underserved areas. Deploy pharmacists in rural and remote regions where access to doctors is limited, ensuring that communities can think pharmacist when they think health. Digital and telepharmacy services. Use technology to expand pharmacist consultation services, enabling patients to access safe guidance anytime, anywhere. Celebration and recognition events. Organize World Pharmacist Day or Week activities like free health camps, screening exhibitions, lectures to showcase the profession's contributions to society. Together, these strategies help transform the theme from a slogan into a practical action plan, reinforcing that pharmacists are essential for safe, sustainable, and accessible healthcare.